Our family experienced an emergency visit that resulted in a 3-day hospital stay while on Medicare, and not just any emergency visit. This one included an ambulance ride. I'll show you how this dollar amount would have been covered if you were on original Medicare only versus original Medicare with a Supplement Plan G, which is what my family member had in this instance, versus a typical $0 Medicare Advantage plan. Okay, this all starts with an ambulance ride. Those who have followed the channel for 2 or more months know the family member I am referring to. She wasn't feeling well and an ambulance was called. Ambulance rides are a Part B expense. The billed amount for a 2.4-mile ambulance ride was $243.15. We are in a state with restrictions on how much ambulance rides can charge, so some of you may see higher costs than that. This happened in early January, which means that any deductibles that you would have on these plans would have reset. Remember, a deductible is the dollar amount that you need to pay first before Medicare or insurance of any kind starts to cover things. Okay, so of the $243.15 billed, we had to pay the $240 Part B deductible first. That is the same with both original Medicare only as well as original Medicare with a Supplement Plan G. Of the $3.15 left over, original Medicare only would have covered 80%, so $2.52, and then we would have had 62 more cents to cover ourselves. With Supplement Plan G, the plan would pay that 62 cents instead of us. This ambulance ride under a Medicare Advantage plan is handled through a copay. I looked at several different Advantage plans in our area and took an average of the different ambulance ride copays with a bunch of different plans, and that average was $215. So on an Advantage plan, we will put a $215 copay. Now we move on to the ER visit. ER visits are usually Part B expenses as long as you are not admitted into the hospital as an inpatient stay. However, when you visit the ER and are then admitted as an inpatient into the hospital, all charges fall under Medicare Part A, your hospital coverage. Since my family member was admitted into the hospital and was there for 3 days, there is one big bill for all of this as a Part A expense. The total billed amount was $44,528. Now, the fun part about the U.S. healthcare system is that hospital providers and payers like insurance and Medicare play this little game with each other. The hospitals throw out a laughably large number as the billed amount. In this case, Medicare looks at that number and because it carries a bigger stick, says, nah, we're just going to pay $15,484, which is what happened in this case. The hospital, because it agrees to participate with Medicare, says, yeah, we were just kidding. We'll get rid of $29,000 of that bill, meaning 65% of that bill amount just went away. If you were on original Medicare only, you would be responsible for the Part A deductible, which in 2024 is $1,632. Medicare would take care of the remaining $13,852. With the Supplement Plan G, original Medicare still pays the $13,852, but the Supplement Plan G pays the Part A deductible for you, so you would have $0 to pay there. Advantage plans typically handle inpatient hospital stays with no deductible, but a daily copay for a certain number of days. The average in our area, I'm in the Intermountain West, is $350 per day for the first 4 days. If the stay is longer than that set number of day limit, the Advantage plan picks up the rest of the costs. These are all-inclusive copays, so they cover the services and costs that you have while in the hospital under this Part A inpatient hospital stay. In this case, the hospital stay was only 3 days, so there would be $350 multiplied by 3 days for a total of $1,050 in copays. One final set of costs to address, and they involve fixed dollar amounts called premiums that you need to pay just to have access to these different coverage options. For this exercise, we are just going to look at the month of January. Later, I'll explain a longer view look at these costs. Original Medicare Part B has a monthly premium. This year, the base premium is $174.70 per person per month. We're going to round that to $175 for this chart. These premiums are income dependent. If you have a higher income, you pay more. In the description of this video, I have a link where you can download the 2024 IRMA cheat sheet that shows the different income bracket ranges and the monthly premium costs. Now you must pay the Part B premium for all 3 of these coverage options with original Medicare only, a Supplement Plan G, or an Advantage plan. A Medicare Supplement Plan G also has its own monthly premium. The average nationally is $150 per person per month. Finally, Advantage plans do not have any premiums typically. There are plans that do, but the vast majority of Advantage plans have $0 premiums. So now we can look at our totals to have the plans and the costs for this 3-day experience looking at just the month of January. The total billed is about $44,771 and then reduced down to $15,484. Original Medicare paid about $13,855. If you were to have original Medicare only, you would be paying the Part B deductible of $240, the Part A deductible of $1,632, and the Part B monthly premium of about $175 for a total of $2,047. If you were to have original Medicare and a Supplement Plan G, you would be looking at the Part B deductible of $240, the Part B monthly premium of about $175, and the Plan G monthly premium of about $150 for a total of about $565. If you were to have a Medicare Advantage plan, you would be looking at the ambulance ride copay of $215, $1,050 in inpatient hospital stay copays, the Part B monthly premium of about $175, and likely no premium to have the Advantage plan itself for a total of about $1,440. Now you could end this video right here, but miss out on the even bigger picture of this financial comparison between these three options, because there are bigger financial costs that play into this equation, more so than most people realize. The first is, what about annual costs? We just looked at the month of January, but what about the months before January that you may have been on Medicare, and assuming you survived this 3-day hospital stay, your costs for the rest of the year? Let's just look at the rest of the year. The Part B premium applies to all three of these and doesn't differentiate them, but just so you know for your budgeting, at about $175 per month, that's $2,100 per year just to have Part B. And it brings the original Medicare only annual total to $3,972, or possibly more if you have a higher income. That $150 monthly Plan G premium comes out to be an extra $1,800 that gets tacked onto the supplement plan column with the Part B total as well. Not to mention any drug coverage, dental, vision that you may want if you go this route, which would cost you even more because prescriptions, dental, and vision are not included with supplement plans. The good news is that if you were to need additional hospital or medical care for the rest of the year, assuming it was approved by Medicare, you don't have any more deductibles, copays, or coinsurance to worry about, but that additional $1,800 in Plan G premiums and the $2,100 in Part B premiums as fixed costs brings the annual total to $4,140, plus whatever additional premiums you would pay for drug coverage, dental, or vision. We go over those averages in other videos like this one up here. On the Advantage side, there are no additional monthly costs to have the plan. They typically include drug coverage and some form of dental and vision at no extra costs. But if you did need additional healthcare over the course of the rest of the year, you would have additional copays and coinsurance amounts. But in this example, the annual total for the Advantage plan includes the Part B premiums and the $1,265 in copays for a total of $3,365. Looking at a slightly bigger picture changes the numbers quite a bit, but we're not done. Let's expand this even more for you. Now, a big knock on Advantage plans is the fact that they are managed care and they have networks. This is true. It is managed care. Most have networks of providers that you need to stay within. The good part about this example that we have covered is that with any Medicare Advantage plan, if it is an emergency, which this example was, the Advantage plan must treat the hospital and/or providers as in-network. So for those on an Advantage plan right now who are worried about emergency coverage outside of your network, like if you were traveling as an example, Advantage plans are required to treat emergencies as in-network. If it's not an emergency, you'll probably want to stay in-network. Now this video is all about actual costs of this event. There are other factors that go into the decision between original Medicare versus supplement plans versus an Advantage plan, which we cover extensively in other videos. But strictly from a cost perspective, the last variable in all of this that many overlook is what is the lifetime cost of having each of these different plans. Meaning in this video, we've looked at 1 month, we've looked at 1 year, but what about the costs over the course of 20 years if you are on Medicare for that long? Now, the long-term look at these plans is vitally important for a lot of people and one that few cover or talk about for some reason. If you want to get an idea of what these types of plans and others will cost you on an even longer period of time with monthly premiums, inflation, rising healthcare costs, and both good and bad years of high costs and low healthcare costs, this video right here goes over just that, and we have a free spreadsheet that you can download and plug in your own numbers in the description of that video. I will see you over there.